Let's face it, aging really sucks. And I'm not talking about the numbers. I'm talking about the physical, mental, and emotional decline that comes with aging. I know what I'm talking about. I'm Dr. Trobisch, and I've been in the same boat. If you give me a little bit of your time, I'm going to explain to you where that comes from and what you can do about it. Let me give you an introduction into hormone optimization and the reasons why you should be getting your hormones checked and optimized. But let's start with the elephant in the room, aging. And the bad part about aging is not really the number on your birthday cake, but it's the decline, the physical, mental, and emotional decline that comes with the aging. Here are actually a couple of the symptoms of aging. That's mental fog, memory loss, depression, anxiety, irritability, mood swings. Then we have the fatigue, no energy, no stamina, like not wanting to go get out of bed or do anything, the loss of interest, hot flashes, and night sweats for you ladies, and insomnia. But that's not all. There's also the lack of sex drive, the problems with erections, having painful intercourse, a hard to reach climax, frequent headaches, and weight gain. And I'm not even done yet because there are also skin changes of aging, and those include the thinning skin, loss of elasticity, increased wrinkles, hair loss, and a dull skin appearance. And that's the reason why we actually look older when we get older. So again, it's not about the number, it's the physical, mental, and emotional decline as we get older. And it's not even it. There's also health problems that come with aging that we usually see in aging adults. The diseases of aging include heart attack, stroke, type 2 diabetes, Alzheimer's, and dementia, as well as thinning bones and fractures. But here's the thing, the real culprit here is actually the decline of specific hormones as you're getting older, and that usually starts around the age of 30. It's a well-known fact now that testosterone beyond the age of 30 starts declining. For men, that's 1 to 2% per year, and for women, it's up to 1% per year with a bigger drop around menopause. Here is how this is illustrated in a picture. You can see here the testosterone decline for men, the yellow line, and then the orange broken line is the decline with women. So it's a well-known fact. There's no question about it. And then the second big player here is the estrogen. And you can see here how the estrogen stays somewhat stable. And then when menopause hits, over here, it's like marked as age 50, but obviously it's different with each woman. We can see a sharp decline of the estrogen. And this is what's causing the symptoms and the illnesses of aging. The good news here is that aging is treatable. In other words, the symptoms are treatable and the diseases of aging, they're preventable actually. And here are the players, the superheroes that will help you to gain your life back as it was a few years ago are testosterone, estradiol, progesterone, thyroid, and DHEA. I'm going to talk a little bit more about these because these are ultimately super important. So first we have the estrogen and testosterone. Those are the sex hormones. Estrogen, obviously, mainly in women, will maintain your health, and then testosterone for men and women maintains the quality of life over time. So testosterone benefits include an increased sex drive. It provides cardiovascular protection, so it's protecting the heart and the vessels inside the brain. It lowers the cholesterol. It protects the brain. It improves mood, memory, and sleep. It builds bone and muscle and increases energy level. So testosterone is the feel-good hormone here, and it's important for men and women. Estrogen, which is mainly for women, it protects against cardiovascular disease by preventing the buildup of plaque inside the blood vessels. It protects the brain by increasing the circulation, and it prevents Alzheimer's and dementia. It prevents bone loss. It restores the connective tissues in the skin and joints, which ultimately helps for our youthful appearance. It improves mood, memory, and sleep. The benefits of progesterone include that it balances the estrogen effects, it protects from breast and uterus cancer, actually, it protects the nerve cells and brain function, it increases the calming neurotransmitters, which is the reason why this is best taken at bedtime. It acts as a natural diuretic and thus preventing fluid retention and bloating, and it helps with weight loss. The next one is thyroid. The thyroid hormone is ultimately important for your metabolism. It helps you to increase the fat breakdown. It gives you an improved sense of well-being. It provides protection from heart disease, memory loss, and weight gain. And then there's also the DHEA, which decreases your cholesterol and body fat. It works as an antidepressant. It prevents diabetes and heart disease, and it improves erectile dysfunction and your sex drive. And overall, it slows the aging process in lab animals. Let's talk hormone optimization at Synergy. The first step is a blood test. Okay, so we do test the blood even before we consider if somebody's a good candidate or not. And what we have to first discuss is normal versus optimal. And I'm going to give you a couple of examples. This is really important to understand. Okay, so we have the real blood test here of one of our patients, a female at the age of 46. We see the testosterone values, and there's a total on top, and there's a free testosterone on the bottom. The one that's more important for us is actually the free testosterone, because that's the active version of testosterone in your body. And again, for a female, her number, it's 1.7. Okay, so the normal values you can see here, these are the ones that end and start with the black bars. The normal value for free testosterone in this lab test is 0.1 to 6.4. But the optimal value here, which is not printed, is 8 to 10. Okay, so in this case, this lady has a normal free testosterone, but she is not optimal. She's far suboptimal, and she should be 4 to 5 times as high on her free testosterone. So there's a big difference between normal and optimal. And then let's look here at another test from the same lady. That's the thyroid. There are multiple thyroid tests here. There's the TSH, the free T4, and the free T3. While most primary care doctors look at the TSH, we look at the free T3 because that's the active version of thyroid hormone. Okay, let's look at the free T3 for her, and we see the normal values of 2.3 to 4.2 as marked here. You see her value is 2.6, so she's normal. She's on the lower end of normal, but she's still normal. And a primary care doctor, I guarantee it to you, would tell her, hey, you don't need any thyroid hormone because you're normal. Okay, but let's look at what's optimal. Optimal for men and women here is 4.0 to 4.4. So looking at her number, she has a number of 2.6, so she should be almost twice as high on her thyroid. Let's look at the male example, okay? It's a male, age 48, and you can look here at the free testosterone, okay? The free testosterone for this patient is 76, okay? So what's considered normal in this lab test is 35 to 155. So in this case, he would be normal. But now again, there's a difference between normal and optimal, and that is 180 to 210. So that's optimal. So based on optimization, he should be 2 or 3 times as high. Okay, so what does it really mean to be normal? And that's what unfortunately most primary care doctors go for. Normal just means you have the same crappy results as everybody else. Okay, normal values just means that everybody else in your age group has similar numbers. Okay, that also means that everybody else will feel like you. And the question is, do you really want to be normal? Do you really want to be normal on your labs and have the same numbers as everybody else? I would think so not. So I urge you to refuse to be normal, especially when it comes to those declining sex hormones. Let's talk about how we optimize hormones. We only use bioidentical hormones. And what that means is that they have the same chemical structure as the hormones that you're used to, that your body made all your life, and they're now declining. We use bioidentical hormones here at Synergy, and this is about how they look like. These are small pellets that get implanted under the skin in a 5-minute procedure, and they last about 4 to 6 months, which means you need to get those implanted 2 to 3 times a year. There's other hormones that we optimize at Synergy, and those include DHEA, thyroid, and progesterone. These come as either tablets or capsules, and they are provided either in office or by prescription to your pharmacy. Blood tests are also an important component of our program because we want to see that we're on the right track, and they're done before the first pellet, and then whenever we do the dose change, or once a year. Here's some patient love. I'm going to read them. Yes, hot flashes, gone. Insomnia, gone. Mood swings, gone. Yeah, I love them. I love Synergy. It is a one-stop shop. After having a hysterectomy last year, I tried all different types of hormone replacing treatments. I came to Synergy and started the pellets, and it was life-changing. And down here, I think we need to normalize men in getting wellness treatments. I had the hormone pellet therapy and Morpheus 8 treatments. I have to say, being 39 and going into my 40s, I feel so much more confident, energized, fit, and in charge of my well-being. The big question here is, do you really need hormones? The answer is absolutely not. You don't need hormones. You don't need hormones if you want to continue your life like you have been. If you want to feel all the signs and symptoms of aging, including being tired, having no sex drive, just overall having the slow mental decline that is considered normal for aging adults in our society. So, absolutely not. If you want to continue this path, then you don't need hormones. However, your answer should be yes if you refuse to be normal, if you refuse to age like everybody else and be in pain and be tired all the time, if you want to be different and if you want to have energy and sex drive and vitality again like you had maybe in your 20s or 30s. So here's to aging in style. I'm Dr. Trobisch from Synergy Wellness, and we have offices in Bakersfield, California, Clovis, California, and Scottsdale, Arizona. I'm going to invite you to learn more about your hormones and what we can do for you.